So, welcome back, students. Last class I have told you regarding the menopause, isn't it? So, in a sequence wise, I am coming for your better understanding. It's not like a unit wise, okay? The important questions till now we have seen is menopause, and the menstrual cycle is very much important. And uh, yeah, that two questions are very much important. You go through that. And next thing is today we'll see till now we have seen what are the reproductive track of the females, and next thing is what are the parts of it, and next thing what is the menstrual cycle and what is menopause and what are the problems in the menstrual phases. So that we have seen till now. So next now we'll see the infertility. So pregnancy we have seen, and sorry, normal woman we have seen, menstrual cycle we have seen, menopause we have seen, and one of the condition it is known as infertility. This is very important question, as menstrual cycle is important, and now this question is very much important, infertility. Now your seniors also has got this in exam, so you have to write what is infertility. Infertility is defined as a failure to conceive within 1 or more years of regular unprotected intercourse. That means the couple, a male and female, should after marriage, after 1 year of marriage, so within that year they should have a sexual life without any unprotected. So they should not use any tablets or condoms like that. They have to be unprotectedly, they have to be uh, uh, followed their sexual life. Even then after 1 year also, if they are not getting pregnancy ante, then it is known as infertility. So mostly we have two types of infertility: primary infertility and secondary infertility. So what is primary infertility? It is nothing but immediate after marriage. So one time also they will not get any pregnancy, so even after 1 year they are trying for pregnancy also they won't come. That is known as primary. In their lifetime they won't get any children pregnancy. What is secondary infertility? One children they have got, after that no, again if they want second child, that time if they got any problem for getting pregnancy, then it is known as secondary infertility. So incidence, mostly infertility problem affects in 1 in 7 couples. Now it is we are seeing more so that is because of pollution or our food habits and everything. No, infertility cases are more nowadays increasing. So what is in theology? Conception depends upon fertility potentials of both male, and it is nothing but it depends upon their potential capacity, because the male should have the all hormones properly, and sperm count should be normal, and the motility should be normal, and the females know the regular period cycle should be there, how many eggs are released and how that healthy eggs are. So these all depends upon these causes. So male factors: defective spermatogenesis. Spermatogenesis is nothing but genesis means production, sperm, production of sperms. If there is any defect in production of sperms, they cannot get the pregnancy. Then obstruction of efferent duct. So we have epididymis duct is there. If any obstruction is there, that we can see failure to deposit sperm high in the vagina, errors in the seminal fluid. So what is seminal fluid? In the seminal fluid only the sperms will be actively movable. Okay, if a seminal fluid is less, then the sperms cannot move actively. So that is a main thing. And also sometimes the males cannot deposit the complete sperms in the vaginal area of the females. That also one of the reason to get pregnancy. So defective spermatogenesis, this is a undescended testis or any congenital problem. Hypospadiasis, that means that ducts are there, no, that should be very narrow. Thermal factors, varicocele, that means fluid accumulation in the scrotal sac. And infections, any orchitis, inflammation of the testis, and gonadotrophin suppression, any hormone suppressions, heavy smoking, alcohol, these all will have the male problems. And endocrine factors, they raised follicle stimulating level is seen in idiopathic testicular failure, loss of sperm motility, I already told you. So Klinefelter syndrome, so where the sperm cannot move, iatrogenic, that means we don't know that is iatrogenic. Drugs or radiation, depression, anything may can have the spermatogenesis. Then obstruction of efferent duct, second one, that is tubular infection, surgical trauma during vasectomy. So when they are doing vasectomy, sometimes they any trauma surgical, when they are doing any vasectomy procedure, that time if they have any damage to that duct or any passage, then it can leads to that. So failure to deposit sperms high in the vagina, erectile dysfunctions may be seen, ejaculatory defects such as premature, retrograde or absence of ejaculation, hypospadiasis, narrowing of the duct. See, this is a penis, these are the two scrotal sac. See, under the penis we have a tube-like structure connection between two testes. The tube-like structure is known as epididymis. They have afferent and afferent duct which are carries the sperm. See, this testis inside the scrotum only testis will be present. The testis will produce sperms. So through this epididymis they will come out. Okay, so this is the structure of the males. So errors in the seminal fluid, so they may be low fructose content, high prostaglandins contains, usually the low volume of, mostly the common problem is low sperms count in the seminal fluid. And what are the clinical manifestations? Includes problems with sexuality, so pain and swelling in testicles, recurrent respiratory tract infections, decreased facial or body hair, having a low sperm count, gynecomastia, inability to smell. These are the things in infertility. So what are the diagnostic findings? History collection, physical examination, seminal analysis test, sperm motility, sperm semen culture, everything you have to do. And you have to do genetic testing also, and endocrine testing, like all hormonal testing should be done for the males. And treatment of male infertility, mostly it is indicated in oligospermia, agiospermia, low volume ejection and impotency. So these are the conditions that we'll see. What is oligospermia? Decreasing in sperm count. Agiospermia, where they cannot produce the sperms outside. Low volume ejections, only little bit amount of sperms will come out. And impotency, they do not have any any sperm production in their thing. So that may be the treatment. Depends upon this, we have to give the treatment. So first thing is you have to treat improvement of general health condition, avoid medications to treat specific causes, specific treatment, and should be, if anything is there, surgical management should be done. So reduction of weight in obese, avoidance of alcohol and healthy smoking, avoidance of occupation that may violate testicular temperature. So avoiding medications includes you should not interfere with spermatogenesis such as beta blockers. That means this atenolol, some hypertensive drugs are there, no, that they should not take. Antidepressants they should not take. Cytotoxic drugs they should not take, and cimetidine should be avoided. So medication to treat some specific causes, HCG, HMG for hypogonadism, and these are the hormones they should introduce in the body. And dopamine, against we can give. Libido means they do not have any sexuality, amma. So to improve low libido, sir, they should have some confidence that they are can able to produce the children. So clomiphene citrate can be given. Antibiotics for general tract infections, anything are there. So specific treatments include intrauterine insemination, in vitro fertilization, intracytoplasmic sperm injections. So these can be given treatments. So insemination, intrauterine insemination, in vitro fertilization, intracytoplasmic sperm injections you have to be do. Intrauterine insemination is nothing but for the males. So the males are cannot get ejaculations problem. So what we have to do, you have to collect the sperms from the males and directly you can insert into the females uterine cavity. In vitro fertilization, so this can be done in the laboratory. So where both the sperm and the egg is collected in the lab, and they are up to embryo stage, they will be developed there in the lab, and then they will insert into the females. And intracytoplasmic sperm injection should be given for the infertility causes. So this is a procedure, amma. I told you already. Simple sample directly into the uterus. See how they are inserting. Okay, directly they were through needle, the sperms are injected directly into the uterine. And in vitro fertilization outside the body. Okay, vitro means in glass. They will do this. See, they will collect the egg and they will collect the sperm outside. They will make one embryo and then they will insert into the, see, through needle only they are inserting into the uterine cavity. There it get implanted and you will get pregnancy. So intracytoplasmic sperm injections, it is ICSI is the most successful form of treatment who are infertile. One sperm which is injected directly into the egg and fertilized egg is transferred to the uterus. So where one egg is selected and there directly the sperm is inserted into the egg and then it is fertilized egg is transferred to the uterus. See, they will be taken outside and then fertilized egg will be again inserted into the uterus. So, surgical treatment vasovasotomy. The vasovasotomy is a surgical procedure in which effects of vasectomy are reversed. So, vasectomy they will do for family planning, isn't it? So here, so due to this, they can do the reverse mechanism. So vasectomy creates an opening between the separate ends of vas differentia. See, if you see this vasectomy have done here. See, they have cutted and they have tied it so that the sperms will not come out. Okay, so that is vasectomy. If you see here again they will be closed it. They will be stitched it and they have created a opening so that they can get sperms will get out and the couple will get pregnancy. So female, now till now we have seen the male infertility. Now we will see what is female infertility. So female infertility are ovulation problems, fallopian tube damage and the risk factors. So what are the ovulation problems? Mostly hormones, luteinizing and follicle stimulating and ovulation. Some women they do not have any ovulation at all. Polycystic ovarian disease, so many eggs are there so that they are very weak and the pregnancy, the females will not get pregnancy. Eating disorders such as anorexia or bulimia. Anorexia means lack of hunger. Bulimia is overeating of food. Then stress conditions can be seen to not to get pregnancy. Substance abuse like alcohol, drugs, intensive exercises that cause a loss of body fat. Over exercise also sometimes they cause infertility. So fallopian tube damage mostly infections due to fallopian tube. Endometriosis, I have told you now already, the layer of uterine cavity is endometriosis. Inside the layer, if it get infected, we not get any pregnancy. So because that endometrial layer only, the embryo has to be go and implanted and go like a baby. So if that is affected, there is no implantation and there is no baby growth. And ectopic pregnancy, sometimes ectopic means outside. So other than the uterine cavity, if the baby is growing, then it is known as ectopic pregnancy. In that condition also you will have infertility. So because the baby cannot grow, isn't it fallopian tube how much it expands? Later it will burst and the baby will come out in the abdominal and it will die. So other than a uterine cavity, the baby cannot grow normally, it will die. So a congenital defect may seen. So what are the risk factor? Age, poor diet, being overweight or the underweight. So what are diagnostic testings that a woman can do? Same thing, hormonal measurements, endometrial biopsy can be seen if any metriosis are there. Hysteral salpingography, complete uterine and fallopian tube should be taken X-ray. Laparoscopy can be seen. Pap smear to check the signs for infection. So what is pap smear? It is like a cotton with a long stick. Okay, so like earbud. So long earbud, so they will insert it through vagina, through cervical area, they will rotate it and they will take that liquid and they will take the moist from the cervical area and they will do testing in the laboratory for any signs of infection, so any bacteria or the virus. So the treatment includes mostly the infertility. We have seen the reasons. No, according to the reason we have to do surgeries and the treatment. So fertility restoration drugs are there. So clomiphene citrate and human menopausal gonadotropins, follicle stimulating hormone. These are all of the hormonal drugs that we can take. And tissue removal, this surgery removes endometrial or pelvic adhesions which are stopping the pregnancy, so that they can be removed. Tubal surgeries, if fallopian tubules are blocked or anything happened to the tubes, then they will be corrected. Laparoscopic surgery is performed to remove adhesions and create a new tubal opening. So this can be done, and salpingectomy, it can improve the chance of pregnancy with in vitro fertilization. So if we do fallopian tube, then in vitro we can do easily, can improve the chances of pregnancy. In vitro means outside we have to do and insert into the uterus. So assisted reproductive technologies, ART, involves removing of eggs from a woman body and mixing with the sperms in the laboratory. I already told you, no. So common ART method are intrauterine insemination, in vitro fertilization, zygote intrafallopian transfer, gamete intrafallopian transfer, intracytoplasmic sperm injection, gift, ICSI, in vitro, intrauterine. You just by heart it. Very, very important questions for your examination. So first thing is in vitro insemination. So intrauterine, you are telling that inside the uterine insemination. The sperms will be injected directly. That is one procedure. Okay. And then gift, it is an art designed to transfer the fertilized embryo in the fallopian tube instead of uterus. So here what they are doing, gift, so they are introducing the fertilized embryo. So outside only they will take one ovum from the mother, and sorry, for the female, and one egg from the female and sperm from the male. They both will be kept in the laboratory and up to embryo stage, and then they transferred into the fallopian tube. So from the fallopian tube it will transfer directly to the uterine. So it is one of the technique. It is also related to IUF only. Okay. So next thing is gift. It is transferring of eggs and sperms into the woman fallopian tube. So fertilization occurs in the woman's body. So here what they will do, gift, only they will insert egg and the sperm. So there only they will mix up in the fallopian tube, only they will mix up and they will implanted in the thing. So these all are the test sum, one by one they will do. And this is about the um, infertility. Okay, so next class will, this is a one unit, one topic actually in your thing. So this is one unit in your thing, so very much important topic for your exam. So read it thoroughly, and you go through it now. After coming to college, if you have any doubts, then you can ask us. See, why you are not responding to our classes, we don't know, ma. Just respond to our class, and if any doubts are, just ask us, you call us, and you write down notes. Why no one is writing the notes and no one is submitting the notes? Each and every time madams are telling that submit the notes, write the notes. See, I am telling you seriously, whenever you are coming to the college, definitely you have to take down all these notes and you have to come to the college. See, after coming to the college, you will go for clinicals. So that time you will not get any time to study. So the main, now if you are go through my classes and reading, no, some will be covered for your syllabus for reading part also, so that it will be easy for your examinations. So go through our classes, write down the notes and read it thoroughly. So next class we will see next topic.